Of all the children in the USA, over 20% of them live in poverty and suffer from malnutrition. In 2003, 1/6 of the total population of the USA was in poverty. The official measure of poverty was set in 1963 and represents the amount of money necessary for 3 times the minimal food diet for one person in today's prices. It does not take into account clothing costs, rent, or taxes. In 2012, over 46 million people were in poverty. The official income for a family of 4 to be considered impoverished is below $23,021 a year. Many professionals, such as Stephen Black, president and founder of Impact Alabama, agree that this standard of poverty is very inaccurate.
If you want to thoughtfully address poverty, it needs to be in reality tied to a family's ability to feed themselves, shelter themselves, provide for their own medical care, and provide a reasonable path of opportunity for their children's success. And very few scholars in this area would suggest that $23,000 a year for a family of 4 should be the bottom. In other words, a family making $25,000 is not in poverty. A family making $25,000 is in poverty by any rational indicator of the issue.
Regardless of how clear it is that poverty is well above a salary of $23,021, the government is doing nothing to change it.
The Congress doesn't want to change the standard and fix the problems with it, because any other standard that we would adopt would erase the number of people that are counted as poor in America, and you'd have more people then that were qualified for welfare programs. So today it's just based on a food budget.
Most impoverished Americans rely heavily on SNAP for food. SNAP stands for the Supplemental Nutrition Assistance Program. Many know it as the Food Stamp Program. However, with the recent budget cuts to SNAP, it is no longer enough to feed the impoverished of America.
People have to be really poor to be able to obtain food stamps. And when you look at how they spend that money over the month, they're already running out before the month is over, and that's when they have to go to the pantries to get help.
Of all families benefiting from SNAP, over 72% of them are families with children, and more than 25% of families have members with disabilities or senior citizens. These families will suffer greatly with the budget cuts the government has passed on SNAP. In the market-based economy of today, it is harder for impoverished Americans to get a job because they are simply not trained to understand how the economy works.
The other part of the problem that the government doesn't deal with is simply that an awful lot of Americans are not qualified for a good job. They don't have the education that's required to really be competitive in the world market. And all the evidence suggests we really should have all children in school by the time they're 3 or 4 years old.
The failure of our government to act does not stop at SNAP. During the late 1800s, the gap between the rich and the poor grew at an alarming rate, much like today's society. The corruption that infested the government and businessmen caused the class division during the late 1800s and early 1900s. The class division of today's society is not caused by corruption, but by neglect of the issue. Kathleen King, the former mayor of Saratoga, California, was once a victim of healthcare instabilities and almost had to sell her house to pay for her son's surgery.
When Robert was very little, he was very sick, and he has a syndrome that there's only 300 cases in the world. And when he was going through his second bone marrow transplant, I was home. My husband was at the hospital with him, and we get a note from the insurance that says, we only cover half the cost of a bone marrow transplant, the second one. And they cost about $1 million each. So I was trying to figure out over the weekend how to raise $500,000. How could we sell the house quickly? How could we close down every child's scholarship fund or, fund for their college? All that, and how I could raise $500,000. Because once a child's in a bone marrow transplant, you don't stop it. There's just no way to stop it. So on Monday, very upset, I called the insurance company and they said, well, that letter was for the hospital, not for you. We're very sorry you got the letter.
Had their family not been insured, they would be experiencing poverty today. Kathleen King is also the CEO at the Healthier Kids Foundation.
So we didn't have to sell the house, but from that day on, I thought about what is it like for a family when you have to choose whether to get your child taken care of health-wise versus other things you need in your life. And so I decided that was my priority in life. And our foundation has worked very hard to make sure all children have health coverage, and we actually help pass a government initiative so that low-income children will have health coverage.
Although modern America is facing serious issues with poverty, there is hope that steps will be taken to make a better future for every citizen, regardless of ethnicity, background, or social class.